We're told constantly how understaffed the NHS how we don't have enough doctors, nurses, surgeons, you name it, we've got a shortage. A new long-awaited NHS workforce plan is due to be published next month, though. Under the plans, the number of medical school places will double. Thousands more apprentice doctors will be trained on the job if it all goes to plan. Of course, these plans will come as the NHS warns it will be short of more than 500,000 staff without a huge boost in training and radical changes to how it recruits frontline health professionals. However, the plans may put the NHS on a collision course with Chancellor Jeremy Hunt, who insists there is no more money available for additional medical school places. But surely, if the NHS is in crisis, this should be if not the top priority for the government. You would have thought, at least. Well, to give his thoughts on these plans is former advisor to David Cameron, Phillip Blond. Phillip, thank you very much indeed for joining me. What do you make of these plans? It does seem extraordinary that when we have acute shortages, we can't up the number of places immediately.
Yeah, and it's worth remembering that during COVID, we did expand the number of places and then we tightened them again rather madly, back down to 7,500. And it's just simply not enough for what's happening, the demographic changes in our country, the ageing population. We dramatically need to increase the number of medical places. Otherwise, we'll go into crisis. And crisis is more expensive than not having a crisis, because if you have a crisis, you don't treat people who are at chronic level and then they present at A&E. And because you fail to treat them or intervene earlier, their conditions are much worse and they cost much more to remedy. So it's a false economy, not building the capacity into the health service. And I would say that we can't afford not to expand medical student training places.
I think most would agree, and I don't know if you've seen reports, but you can also see all of this on TikTok and social media constantly. Australia seems to be the hotspot for our doctors and nurses to go to, and they're actively trying to poach some of our staff now.
Yes, I mean, look, the management of the NHS in terms of its staff is pretty insane. We've also introduced pension rules that, in effect, charge doctors if they want to continue working for the NHS after their point of retirement, which has robbed the NHS of a huge tier of highly experienced staff. And those experienced staff can teach doctors not to make mistakes, and those mistakes can have fatal consequences for patients. So it just seems very peculiar to me that we can't muster the management ability to retain our staff, to remove these pension penalties that doctors and particularly specialists and consultants are experiencing. And we've got to create sort of wide pathways for people to return to medicine and practice medicine. But the real point is to ask, why is our system in crisis? And our system is in crisis because it's essentially not organized on a systemic basis, probably because of its historical development. You have multiple different institutions where nobody is in charge. We've balkanized our largest public service provision, and it's impossible to govern it from the centre. And in practice, each separate part of the NHS can declare its own rules, needs an enormous amount of bureaucracy to work together. I think if we're going to produce 21st century healthcare, we have to restructure the NHS. And I think we should devolve health. We should recreate local health structures that deal with the specific health problems that are often to do with the demographics and the economics and the social history of a place, and integrate healthcare at the local level. Keep central provision for things like funding of medical research at scale and for specialist hospitals. But the real key is that our doctors if you forgive the term, our chronic care is failing. The chronic care is what keeps people out of hospitals, stops them going in. And we need to push services out of hospitals where beds are incredibly expensive, and we're getting people with conditions that could have been treated in the community, could have been treated at home, but essentially because the service is dysfunctional, they're not.
Yeah.